Hello again, everybody, and welcome to this edition of Cogeco North Bay News, truly local television. I'm Greg Esterbrooks. Well, finally, some good news at the North Bay Regional Health Centre. A specialized women's forensic psychiatry unit is going to be used by the entire province, and it will be set up at the hospital. The $4.4 million announcement was made at the future site of the new forensic unit at the Regional Health Centre on Wednesday.
The women will be referred to us by our partner forensic hospitals in Ontario. They will have likely led very complicated lives and will likely have had clinical challenges in the referring hospitals. So they will present with complex mental health disorders, challenging behaviors, either harm to self or others, and pose a significant risk to the safety of the public. So they will be subject to Ontario disposition orders, so they will be forensic female patients who require longer-term stay in an intensive area that will provide, sort of a very therapeutic environment, and in particular, I want to highlight the assessment. And so having to figure out and really assess the trauma or the illness behind the presenting symptoms of challenging behavior. So trying to understand that a little bit better. We've been discussing the needs of female patients who are posing, who have great challenges, and the need for a gender-specific area. So they're located all over Ontario, and so they will be referred to us by those hospitals. We're moving into the realm of providing a provincial service, and that's a first for North Bay Regional, and a first, I think, for North Bay in terms of healthcare. Women will present with very unique backgrounds, and so mental illness is manifested differently among women. So they tend to have higher rates of substance abuse. Their offending behaviors are very different than men. Women tend to not need structural security per se. Women tend to focus on relationships, and so we have to offer an environment that's more focused on the traumas that are unique to women.
And this is an expensive proposition, so how will the money be used specifically?
Specifically, so we are having to establish a whole new team, highly trained, highly qualified folks that are informed about the gender uniqueness, the gender-informed approach, therapies that are tailored to the needs of women.